Children with a chronic disease often face challenges in their day-to-day life that are difficult to understand for their peers and difficult to talk about. For example, kids with cystic fibrosis, a disease affecting the lungs and other organs, need to go to the hospital regularly, take medication to suppress health problems, and are more often out of energy than their peers. Communicating that they are still ill after visiting the hospital, why there always will be medication, and that there are consequences for actions that are simply not there for their peers is challenging. There's not really the right moment. Finding the right words is difficult, and explaining how it feels to be chronically ill without having experienced the limitation is quickly misunderstood. We developed It's All in the Game to start the conversation about the effects of a chronic disease, create game-based arguments that speak to the implications of a chronic disease, and to provide peers and parents with terminology and examples for discussion. It's All in the Game is a multiplayer board game designed for 4 players. The goal of the game is to successfully plan a week in the life of a cystic fibrosis patient. Players play with randomly drawn resource cards to acquire activity tokens, motivation, energy, health, and time, or chance cards, and to try to complete their personal challenges on their personal game board. Designing It's All in the Game, we followed a player-centric approach, frequently involving players of different ages, with and without cystic fibrosis. During the design process, we differentiated between representing the implications of cystic fibrosis, the general playability of the game, and the communication value of the game. We remotely interviewed patients with cystic fibrosis at the beginning of the design to provide interim feedback and to evaluate the final product. To be respectful to patients' time, we polished most of the game mechanics, game balancing, and communication about technical aspects of the game with a weekly test group. During the design process, we learned about challenges to represent disease in play, to design arguments about illness in play, and to reflect on the negative implications that disease communication and peer learning can have on children with a chronic disease. Our work demonstrates the potential of applied game design in shaping communication between peers, showing an avenue to contribute to reducing disease burden, combat loneliness, and increasing the quality of life for children with chronic disease.